Are you ethically and legally in control of your own life? Do you have the right to end it? And if so, will you be able to get legal assistance for your suicide? What if you are terminally ill? Will you be allowed a good death? Euthanasia? Or is suicide wrong for some reason? Is it wrong to assist someone to die? What if your spouse is comatose and wished in their will that they would not be kept alive in such conditions? Are you allowed to help them die? Or is it simply always wrong to cause someone, anyone, yourself included, to die? These questions about suicide and euthanasia are discussed in Applied Ethics, which is what I have recently been explaining in my video series Introduction to Ethics. They are, of course, what this video is about. My name is Jouni Vilkka, and this is my channel, TFF, Teacher from Finland. Please consider subscribing and clicking the thumbs up button. There is a possibility that even discussing death, and especially suicide, has harmful consequences. Apparently, news reporting on suicide may increase incidents of suicide. It is said that when Goethe published his, in my opinion, extremely boring book, The Sorrows of Young Werther, in 1774, there were cases of copycat suicide where young men, inspired by the main character of the book, committed suicide by shooting themselves. I don't wish to give anyone additional motivation to commit suicide by discussing the subject, but it is an important subject for ethics, so it cannot be avoided. Nor will suicide cease to be committed if people just stop talking about them. I will discuss both suicide and euthanasia together in this video because I see them as similar, connected issues. First, I will go over some basic definitions of euthanasia, after which I will discuss some of the ethical issues related to suicide and euthanasia. Finally, I have something to say about suicide specifically. If you are considering committing suicide, I hope you will at least watch this video to the end first. Euthanasia means good death. It has come to mean assisted death, although most people probably think that the best kind of death doesn't require assistance. It just happens naturally and peacefully. Most people, unless I'm mistaken, hope to die in their sleep when they are very old. Especially in the past, other ways of dying well have also been idealized, such as dying courageously in battle, but most serious people no longer seem to care for such things. The reason why euthanasia has become an important topic in fairly recent history is that more and more people live to such an old age that their brains begin to fail before the rest of their body. The ability of modern medicine to keep people alive is so advanced that it may even seem like a problem. Some people survive accidents but remain paralyzed from neck down. There are even cases of locked-in syndrome, also called pseudocoma, where the person is unable to do physically anything other than to move their eyes, making communication difficult to say the least. It may not be surprising that some, although not all, people would prefer to die rather than exist in that state. For some people, life can be unbearable, even if there is nothing physically ailing them. They may choose to commit suicide. It could be thought of as a good death, but like I already mentioned, euthanasia is distinguished from suicide to mean the kind of death that requires others, usually physicians. Even suicide by cop is considered a form of suicide because the cop in question is being used instead of willingly participating in the role of a healthcare professional. The police officer, at least if trained in Finland, would probably not even shoot to kill, so the chances of success for the suicide would not be very good. Euthanasia, assisted by a physician, is certain to succeed. In her article, Euthanasia, in A Companion to Ethics, edited by Peter Singer, Helga Kuuse defines voluntary euthanasia as euthanasia carried out by A at the request of B for the sake of B. That is, A kills B because B asks for it and it is in B's interest to be killed. B does not need to be cognitively competent at present if they have expressed their will earlier, before becoming incompetent, for example due to dementia or coma. Kuuse defines non-voluntary euthanasia as otherwise the same as the above, except that B is unable to make the choice between life and death for themselves, and has not done so in the past either. B could be a previously competent person who had an accident, rendering them incompetent somehow. Or B could be a newborn infant so severely handicapped that their life will consist merely of suffering without any hope of ever reaching cognitive competence. Kuuse defines involuntary euthanasia as one that is performed on a person who would have been able to consent to their own death, but did not consent. Either B was not asked whether they wanted to die or not, or B withheld consent, wanting to continue living, but was killed anyway. This may sound like simply murder disguised as euthanasia, like the Nazi Euthanasia program, which was simply the large-scale murder of the mentally ill and disabled people the Nazi wanted to get rid of because of their unethical ideas about eugenics. But there are other possible cases of involuntary euthanasia that are not as clearly wrong. Kuuse's example has A shoot B without B's consent because B is about to fall into the hands of a sadistic torturer. A thus kills B in order to save B from torture. A is certain B will eventually be killed by the torturer, so killing B is not changing the final outcome for them. It just removes the torture. There are also more realistic examples of involuntary euthanasia. Kuuse points out that it has been argued that some widely accepted medical practices, such as the administration of increasingly large doses of pain-killing drugs that will eventually cause the patient's death, or the unconsented to withholding of life-sustaining treatment, amount to involuntary euthanasia. A commonly used and important distinction is between active and passive euthanasia. In the active case, A actively causes the death of B, for example by giving B a lethal injection. In the passive case, A allows B to die by not preventing B's death, even though A could prevent it, at least in the short term, thus prolonging B's life for a while. B might be suffering from a terminal disease, but as their physician, A could postpone B's death time and again. Not doing that, allowing B to die, is often considered an act of mercy. So is hastening B's death in some cases. That is why euthanasia is also called mercy killing. If a person is considered to have complete autonomy, as David Hume thought, that includes the right to decide to end their own life. This had been the view in antiquity as well, but Christianity had changed the common attitude regarding suicide. Christians thought that human life is sacred and murder is prohibited. They thought that suicide is a kind of murder, destruction of sacred human life. Rather than thinking of the evil done to the person killed, they thought it was acting against God that made it a sin. Immanuel Kant argued that humans have intrinsic value, and the autonomous reason we have is also the basis of morals. This reason would be destroyed in suicide, which somehow supposedly means destroying morals as well, if I understood his point of view correctly. By killing themselves, the person treats the humanity in themselves as merely an instrument, a means to an end, against the categorical imperative. The existentialists emphasized freedom and our ability to make our own lives meaningful through our choices. From this point of view, suicide can be seen as an escape from responsibility. Being able to commit suicide means being able to always make ethical choices. Even a guard in a death camp can choose to disobey commands. They can always choose to shoot themselves rather than the prisoners, for example. I think that would be the proper way to exercise one's freedom to commit suicide. It would not be just an escape, and especially not an escape from one's responsibility. If one commits suicide in more ordinary circumstances, it does become just an escape. Even if life is absurd and fundamentally pointless, it can be seen as a kind of heroic endeavor. Even Schopenhauer and Hume thought that suicide, while not ethically wrong, is usually a mistake, as a better solution to the problem at hand could be found. It is often said that suicide is a permanent solution to a temporary problem. A depressed person might not be able to see other solutions very easily, which is why it would make sense to seek help rather than make what might be less than the optimal choice. Because a sick person wishing to have assistance in dying, euthanasia, can also be suffering from depression, it similarly makes sense for them to get help for depression before making permanent decisions about their own life. But it is possible that their situation is so bad that it makes little sense to continue suffering. Heta Yüling presented a thought experiment to clarify this point. Imagine you are given a choice between 1. Immediate death, or 2. 2 weeks of torture ending in your death. Which option would you choose? There is no hope for rescue. You will die either immediately or in 2 weeks. The latter just involves torture, much like in Kuuse's example with the sadistic torturer earlier. If you choose the second option, you will only postpone the inevitable and force yourself to endure much more suffering. This seems a lot like the situation some people actually find themselves in. Their torture is suffering the last stages of some horrible, incurable disease. They will die soon anyway, and their suffering will only increase as death draws near. It seems understandable that they would wish to skip the suffering part and just die a little sooner instead. If they manage to commit suicide, there is usually no legal issue. I find it difficult to see any ethical issue either, although your mileage may vary, of course. The situation becomes more problematic if the sick person is unable to commit suicide, which really is not easy, despite some people claiming so. It goes against the most primitive instincts of any organism, after all. Being unable to end their own lives, they may ask for assistance in dying or active euthanasia. The main problem with euthanasia, as far as I know, is that the person assisting has to be a physician in order to be qualified to help, and assisting the suffering person can cause them problems. First of all, they have to be legally in the clear. Second, they must not be risking the future of their career. Third, they may have made an oath or otherwise be bound by ethical codes that at least need to be dealt with. Finally, they may themselves suffer psychologically because of the request of euthanasia, as well as actively taking part in it. This can be very stressful, and it can be emotionally taxing in other ways as well. For a person or society to require some healthcare professionals to go through all this may be ethically questionable. There are ways of making euthanasia more acceptable to the public and the physician involved. It seems to me that passive euthanasia is generally accepted, or at least there isn't that much resistance to it, as there is for active euthanasia. The reason, I suppose, is that it doesn't involve actually causing the person to die. An action is considered ethically more significant than an omission. If B is gravely ill and all A does is let them die, A is not causing the death. Even then, if A is a physician, it can be thought that the job of the physician is to prevent death. They are not supposed to just let someone die. Certainly, if you're injured in an accident and end up in a hospital, you expect the doctors to try to save you, not just let you die. If they have the means to save your life, but decide not to, it seems clear that they are more than failing their duty. An omission can thus be ethically wrong. But all situations are not the same. In some cases, you may wish they would let you die. The problem is that they need to know it, and if you are, for example, in a coma, how can they know what you would want in that situation? Hopefully, you have loved ones with whom you have discussed these things in the past. But you should also have a valid last will and testament properly prepared. You don't have to be old or ill to have one. You never know when your days are up. In addition to one where you express your wishes regarding your property, you should also have one about your medical treatment. Here in Finland we can make our own advanced decision known using the online services of the Finnish Institute of Health and Welfare, where we can access our medical records. You need to figure out how to do the same in your own home country, but the point is you need to have a written legal document that states your wishes regarding treatment in case you are unable to communicate it at the time. Otherwise, your doctor is going to have to default to the standard practice. Perhaps your loved ones can be consulted, but you can avoid having to force them to make decisions for you by making a proper will in advance. Some people choose to make a DNR or do not resuscitate order. They can have DNR tattooed on their chest or carry a bracelet with DNR printed on it. These are not legal documents themselves, but let people like first responders know to check the actual order. This order means that the person is not to be resuscitated if their breathing or pulse stops. They don't want CPR. The healthcare professionals treating them are relieved of their duty to try and save their life. This seems like a case of passive euthanasia, doesn't it? But couldn't it also be seen as a passive form of suicide? By ensuring that your life will not be saved, you at least make your death more likely. You just don't actively try to end it. As long as no one is actively doing anything to end your life, it's hard to see any ethical problem here. Often the choice in a hospital is not between not treating the patient at all or treating them using any means available. The fact is, resources are always limited, and the patient is not always likely to benefit a lot from having the most advanced high-tech treatments. They might live a month longer, but at what cost? That last month of their life could be unpleasant, to say the least, and the resources spent on them could be more beneficially used elsewhere. So, One may wish only to be given ordinary as opposed to extraordinary treatment. If a patient is suffering and wishes to die, but active euthanasia is not an option, it may be useful to distinguish between intention and foreseeing. Helga Kuse explains that it is possible for the physician to be able to foresee that increasing the patient's pain medication, even incrementally, will eventually lead to their death. The intention of the treatment is to remove the pain, not to kill the patient. Yet both are consequences of the same action. This is called the principle of double effect. The direct intention is pain relief, and pursuing it allows the other consequence as well. The intention of the physician may be the only ethical difference here. The consequences of providing the patient either 1. A lethal injection, or 2. Incrementally large doses of painkillers are more or less the same. Psychologically, it may be easier for everyone involved to accept the latter, but it is not obvious that it is the best choice. It could even be argued that actively killing the suffering patient would be a better thing to do than to force the patient to go through more suffering. Of course, the painkillers may successfully reduce the suffering. Active euthanasia has been legalized in some countries in recent years. In most countries it is still illegal. There are many NGOs advocating legalizing it because many people see a great need for it. Someone may wish to die but is unable to commit suicide. Even with the DNR order and an illness slowly killing them, it can take several years before the torment is over. But even if euthanasia were legalized, it might still be difficult to get the assistance required. Most physicians may be reluctant to participate in it. We all have to die eventually, and we all probably would prefer a good death. What that means to each individual may differ. Some choose to take their own life even at a young age. You may have had suicidal thoughts yourself. I certainly have, since I was a child. It is normal to have such thoughts once in a while, but if they persist, you should probably talk to mental health professionals. Life is short, even if you live to 125, which is pretty much the maximum a human can reach. There are many changes during life, especially between ages 10 and 30. Emotional maturity seems to develop only closer to 30. Things are likely to get better. Even if you don't want to live anymore, you can rest assured that you will soon die, because the older you get, the faster the years just fly by. You may be able to make a DNR order, increasing your chances of dying sooner, and you can think of it as a form of passive suicide if that makes you feel better. I am not one to condemn suicide, even an active one as such. I cannot know what someone else is going through. For me, studying philosophy has been an important change that improved my life. Before that, I was frequently close to suicide, but not since. Life can be meaningful if you make it meaningful. But if you do want to end your life, there are still some ethical points to consider. You no doubt are aware that other people will be affected by your actions. You should minimize the harm you cause others. This includes not only those who may care for you personally, but also the people who have to deal with the consequences of your actions. For example, the person finding your dead body, those who may have to clean the place of your death, those who may have to identify your corpse, and so on. You shouldn't leave your affairs in disarray, so make sure you have a will and a note clarifying your intentions. Make sure you have a driver's license or at least dog tags. of some kind on your body when it is found. Don't force others to do the killing for you. Even a police officer might not deserve the problems they will get from shooting someone who wants to die. It might affect them psychologically or career-wise, or at the least, it would force them to do additional paperwork that they probably wouldn't want. More importantly, there is a chance that they will not shoot to kill, so suicide by cop is a gamble. For example, in Finland, police officers almost never shoot to kill, as they are trained better than that. If you don't actually want to die, don't pretend you do. If you really do want to kill yourself, there are ways of making it certain to succeed, without involving other people. Do not, for example, think you can just drive fast and die in a car crash. Idiots sometimes try that, but end up just killing others. Think harder. Make sure you cause as little harm to others as possible. Suicide is among the most difficult things anyone can do, and it can be honorable, but that requires properly thinking it through at length while sober. Not after a single lousy day or a single shameful experience in an emotional state or something equally stupid. Some people carry out an extended suicide by killing others, often family members, before killing themselves. This is almost always wrong, as should be pretty obvious, because these others are victims who did not choose to die. If you want to die, but have people depending on you, first make sure they will be taken care of. You cannot make the decision to die for someone else. Killing others, for example in a mass murder, so you would be killed, is at best a gamble, and certainly a dishonorable, cowardly attempt. Even if that enables you to commit suicide, it is not the honorable way. A true warrior is able to simply end their own life without troubling others, and I will always respect anyone who is able to do that. Just one last thing to consider. If your life is miserable and you want to end it, there is another way besides suicide. You can instead dedicate your life to a good cause. Discard your previous life and put all your effort into helping others by joining an organization. I'm sure there are organizations that would benefit from having a volunteer whose only goal, even only content in life, is to work on the issues they are focusing on. There are big organizations like the Red Cross and Doctors Without Borders, and smaller ones like XR, Extinction Rebellion. Maybe there is a soup kitchen near where you live. Find an organization working on issues important to you and ask them how you can help. In fact, I'd appreciate suggestions for good organizations in the comments below. That's all I wanted to say this time. Thank you for watching and come back soon for more videos on ethics. Bye for now. If you wish to support my channel, please click thumbs up, subscribe and share my videos. Any comments on the videos would also be welcome.